Our first speaker is Ward Detwiler. He's a product manager at Henry Ford. Ward is the innovation manager for health systems innovation, which leverages systems intellectual assets to develop commercial and mission-based solutions to the world's most pressing healthcare problems. And I've lost my other sheets, but I'm going to invite Ward up straight away.
So I was kind of hoping I was going to have walk-up music, like before. This is the greatest conference I've been to. All right, so I just want to just be really quick here and just say a couple of comments. First of all, I'm really excited that this is even taking place and that Paul invited me to be a part of this. One of my biggest passions is I think the economic rebirth of this region, and when I look at some of our biggest natural resources, if you will, we have healthcare, we have a huge amount of engineering talent in this region, and we also have an incredible connection, an international border, one of the biggest trade crossings in the United States. So, otherwise, Canadians, thank you for being here. So it's pretty unique to have all those resources together in one place, and I think some amazing things can come forward from it. Mainly, I also think that this is really important because, in my mind, this is the first time we've kind of had something that's so uniquely focused on digital health. And I hope this can be a catalyst going forward for this industry in this region, regardless of what happens with your amazing inventions and hacks that you come up with over the weekend. So I want to give a quick overview of Henry Ford Health System Innovations and what we do and kind of why we were founded. So about 3 years ago, our leadership looked out at the healthcare landscape and saw some really big challenges coming our way. We saw a changing payment landscape. We saw a huge increase in chronic disease, aging population. We saw rising costs. But the other thing we saw was this wave of new technology coming into the industry that really was poised to disrupt what had otherwise been a pretty slow-moving and kind of in its place profession. And I can say that I'm not from the healthcare industry. I come from a traditional tech startup background, so I come with that perspective, I suppose. But the other thing we looked at was that, you know, hospitals are not just these factories for making sick people well. They're also these huge collections of talent, of capital, and technology. And these are really the building blocks for innovation. So in order for Henry Ford to prepare to thrive for its next 100 years, this is our 100th birthday, by the way. Thank you. Yeah, I know. We don't look a day over 50. But in order for us to really thrive for our next 100 years, we wanted to find a way of how do we leverage these assets to address these huge problems. And that's what Henry Ford Health System Innovations was created to do. So we are kind of comprised of a couple of different strategic units to really achieve this goal. And I'll just kind of give a quick overview and maybe give a couple words of how they relate to all of you guys. So first we really started with a focus on research and education and training, and that's the Henry Ford Innovation Institute. It's a separate 501c3, separate from the health system. And in my mind, that is really our culture change organization. One of the biggest challenges in healthcare, quite frankly, is changing the way people think about their jobs and think about their roles every day. While we have incredibly talented, incredibly smart people in the industry, most healthcare professionals they're practitioners. They have a job to do. You're not really rewarded for experimentation, rightly so. I don't want someone like cutting me open and being like, what are we going to do today? So the first thing we did was set up a place where people could be a little bit more experimental, where they could kind of experiment with ideas where they could, honestly, where they could fail. That's not something that's encouraged inside of the hospital. Again, good thing. So we set this up to really focus on how do we train our employees, how do we educate them to think about being problem solvers, give them the tools to be more entrepreneurial, to bring things to market. So with that in place, we moved on to creating our tech management program. And this is really the arm that focuses on taking our internal assets and bringing them to market. So we we have, depending on how you count and what year you're looking at, we have somewhere between $70 and $100 million of federally funded research. We're actually the 4th largest research institution in Michigan, behind Michigan State, and Wayne State. So there's an incredible amount of new ideas that are just being generated through that research that need an outlet. So when we opened our doors, there was this huge wave of inventions that came our way that we looked to process and bring to market. And that's great, but really, that's sort of a really reactive view, right? That's saying, here's research, what are we going to do with it, where is it going to be its home? On the other side, we have 5 hospitals, we have a wholly owned insurer, we have 1,250 positions. We have 20,000 plus employees. That is a ton of people and a ton of resource that's on the front line of medicine that is seeing problems at the point of care, and people who are thinking of solutions to those problems every single day, but again, without an outlet for bringing those ideas forward. So we really wanted to focus on being very proactive in our tech management and our tech development. So that's kind of the viewpoint we take, is it really is starting from a problem perspective and bringing things forward. And I'm really happy with the progress we've made in the programs or the products that we've been bringing forward. But taking another step kind of out, like an outward ring, right? When you think about what's kind of some of our other assets, it really is the health system itself. The level of integration that we have, we're fully vertically and horizontally integrated. We have pretty much every specialty under the sun. We have an amazingly diverse patient population. That's a really great resource for fostering innovation. And I know, coming from the kind of, I'd say, non-healthcare startup world, how, I guess, retrospectively easy it is to start a company in the outside world. You come up with an idea, you do customer discovery, you do development, and you go to market. When you develop for healthcare, there are all these hurdles that you're going to encounter, and I'm sure a lot of you have hit some of these hurdles. You have privacy and safety regulations, you have how you're going to integrate with IT, you have the fact that your user is not necessarily your customer or your payer. So you really need to have this total view of the world of healthcare in order to develop successfully. So what we've done is created our corporate partnering program, where we work with outside companies, we work with startups, we work with large corporations who are developing new products for the world of healthcare, and really become a vested partner in the development of that product and help them get to market successfully and quickly. So I think that's been a very successful program. It's really just getting up and running right now, and I think it's something that can be a big resource to our region and to our community as you guys start to bring new ideas to bear. Taking an even further step back, we realize one of our big assets is our care delivery model itself. The thing that we do very well is deliver high quality care in a scalable, low cost way. And that model is very applicable not just in our own community, but across the world, as we see emerging countries start to have larger middle class populations, start to have increased incidence of Western disease. What we're doing now is licensing our care model to the international market, to the developing world, to create hospitals in markets that need that sort of care model. So that's sort of the view of our system as a whole. Then I also want to just give a quick plug to sort of what our prize that we're providing today is, or over the weekend. And we're giving you guys the opportunity, we're very focused specifically on what the prize area that we're focused on is caregiver innovations and caregiver support tools, and also just patient management tools. In order for healthcare to really survive in the next kind of period, we need to keep people healthy and keep people out of the hospital, and we need to recognize the people that keep those patients healthy, so that the family members that help support those people who are dealing with chronic disease, who are dealing with aging, it's a tremendous burden that they have. They spend a lot of money, they spend a lot of time keeping their family members healthy, and we need to help support those people in order to keep the patients healthy. So what we're doing is, whoever we think has the best innovation in that area, we are going to offer a ideation and design session with our team to bring you in with our commercial team members, but also with some of our clinical team, to kind of assess your idea, to hopefully work through a couple paths forward, and if it looks like there's something there and that it might be successful, to offer up the ability to work with us and to kind of go forward. No guarantees, obviously, but that's an option to go forward. So we're really excited to be here and to be part of this, and I wish you guys all the best of luck over the weekend.